Thanks, Aisling and Alistair and HRB for the invite. So I'm going to provide probably a little bit of a juxtaposition to Kieran's talk. So Kieran talked about the opportunities for platform involvement through the lens of the Panther trial, but I think it'd be fair to say that while Panther's playing chess, most of us are playing checkers, and access to platforms is actually potentially hard for ECRs. And I'm going to talk to you a little bit about how I've gone about accessing a platform trial as an ECR. So I'm going to talk a little bit about mentors, how you select a platform, how you actually get access to that platform, and where we provide benefits in terms of grants. So there is no science here. There's no policy. It's in stark contrast to some of the talks this morning. It's purely based on my experience from N=1, right? So mentors are really important. This gives away how old I am, because I'm the oldest early career researcher in the whole of Christendom. In the 90s, when I was at school, my dad and I had to talk about what I should do, and I said, I want to be an architect. And he said, no, you shouldn't, son, you should be a doctor. And then I went to medical school, and I said, I want to be a surgeon. My sister, who's a GP, said, no, Peter, you're nailed on anaesthetist. And she was right and I was wrong. And then when I did anaesthetic training in the UK, when you do anaesthetics, you can go one of two ways: intensive care medicine or chronic pain. And chronic pain in the UK has this phenomenal private practice. And I said to my educational supervisor, Chris McConkey, I'm going to do chronic pain. And he just laughed. He didn't even try and hide it. He just laughed. And then when I went into intensive care, I said, I'm just going to be a clinician. And Danny said, you should do research. And here I am, hence the reason why I'm the oldest early career researcher, right? So be careful what you wish for in terms of mentors, because had I ignored their advice, I'd have a big house, fame, fortune, and a really easy life, okay? So mentors can see things in you that you can't see in yourself, but you got to pick the right one. And somebody told Kenny Bailey, I'm sure you know who Kenny Bailey is, who really clever guy working in Edinburgh who runs the genomic trial. And when he was an early career researcher, somebody said, go and find the person who publishes in Nature, and that's your mentor. And actually, I don't think that's true. I think what you want for as a good mentor is somebody with 4 skills. And this is from my own experience. That's advocacy. So somebody who's going to fight your corner and, be a sponsor for you to put you forward for opportunities. Somebody who has skills that you can learn from. And whether that is translational science or trial methodology or health economics. Somebody's got content expertise, and somebody who gets grants, because we're nothing without grants. And if you're lucky and you can find those 4 skills in one person, great, but often it's not, and you might have to have 2 or 3 researchers, or you might have to have 2 or 3 mentors to get all those skills. If you're lucky, you say, for example, I know not everybody here is from a critical care background, but if you work in Ireland, there's a heavy focus in the critical care community on promoting early career researchers. And if you're really lucky, you exist within a platform that has a structured early career researcher program and a commitment to bringing early career researchers forward. But that is not the case for all platforms. So if you have a mentor that has their own platform, right, they bring context-specific expertise, they've established collaborations, and they can put you forward to collaborate with people around the world. They have influence on world leaders, which provide opportunities, and critically, they provide access to that platform, because not everything's going to be as egalitarian as Panther. But let's get real. Not everybody's mentor has their own platform, right? Because we've already heard this morning from John that actually the number of people who run these things is very, very small. So how do you get access to another platform where you have to develop your own topic-specific expertise, establish your own collaborations, carve out your own opportunities, and only get access with time? That is a much, much harder road to travel. And it's something that I've done. I'm going to talk about some of my own thoughts about how I did it. So I think at each step of the journey, you need to add some value. So how I went about this was I was site principal investigator for a large cardiac arrest trial. And that's not just about being site principal investigator. You have to put the patients in the trial. And when they're in the trial, you have to deliver the trial intervention with fidelity. And you have to make sure at the end of the trial, your data is clean and there's no missing outcomes and you've delivered it and delivered it well. And those things, just doing it and doing it well, will automatically stand you above a lot of other units and people start to take notice. You then have to demonstrate that not only can you deliver on implementing a randomized controlled trial, but you have to demonstrate that you're an academic partner. So whether that's reanalyzing data or whether it's doing some translational science that sort of Kieran was talking about, I think is important. And sometimes that looks like sub-studies. So we did a lot in TTM about the CT brain results and the EEG results, and it was just about gathering the data and inputting into, well, how do we analyse that? What does it look like? Inputting into the papers. And when the next domain comes along, for me, what this meant was I became the national investigator in the UK, and you then have to recruit, you then have to coordinate other centres, and I started to lead sub-studies and coordinate all the sub-studies in the UK, and suddenly you're moving up the value chain and demonstrating that you're bringing value to this platform. At some point, there is going to be a discussion about what the next domain looks like. And often that is held in rooms where there's free discussion. We set aside 2 hours at a meeting to discuss what the next platform is. And I think there's a spectrum of how you respond to that, right? You put up your hand and go, I have an idea, right? And shout it out. And it's this nascent idea that is not very well thought through, and you are 18 months away from where you should be. And then the next level is you have an idea and you have put some slides together. I've got 4 slides as to what this would look like. Okay? And the next level is I have an idea and I've done the systematic review. And the systematic review has been adopted by the International Liaison Committee on Resuscitation. And this idea matches the James Lind Alliance research priority setting exercise. And I've done some PPI engagement through Leanne Hayes. And I've worked with a trial methodologist, so I know what the sample size is. And I've identified potential funding streams that you can't get, but I can because I'm an early career researcher. Oh yeah, and I've got some slides. So if you turn up to these meetings like that, and you've got a slot on the agenda, you are a year to 18 months ahead of everybody else. And these, probably be fair to say, platforms, there are no shortage of ideas. There probably is a shortage of people who are at the point where you can implement these ideas into practice. You have to collaborate well, right? So this is Beatlemania, right? So see all these, right? There's 30 people, right? And they all want Lennon and McCartney, right? And that's like the chief investigator. And see this girl down here? She's pitching for Ringo. And I think her chances of getting access to the Beatles are much better having worked with Ringo than it is trying to get Lennon and McCartney, okay? And I think that analogy is true, right? So if you're an early career researcher and you're trying to get access to the chief investigator of the platform, that person is phenomenally busy. There is 60 people vying for that person's time. But you're missing a trick if you think that they are the only decision maker in the room on the domain prioritization panel, because that person does not exist on their own, right? Lennon and McCartney did not exist on their own. They existed with the Beatles. And in the years between recruiting your first patient and when the next domain gets decided upon, you can be working with other trialists on reanalyzing other data, doing some translational medicine work. You can work with the trial methodologists, and what I did was, some of the trial methodologists, work with them on systematic reviews about potential next domains. You can work with the health economist, and I think those of us who know that somebody like Lisa is probably a very, very important decision maker in the REMAP CAP family. And suddenly then, when you're not in the room and decisions are getting made about what the next domain is, you've got 4 advocates on your side. It's not just your chief investigator, but you've other decision makers in terms of the trialists, the methodologists, the health economists, all these people who decide what's next are going, oh, that guy's, that person's not a bad person. They've worked up their idea, they deliver on their projects, I think this is a viable proposition. And some of that means that you bring solutions, not problems, and you do some work. The other thing that you can bring is money. And that is hard to ignore, right? And as an early career researcher, this is probably important because we've heard about how platform trials are hungry beasts and it's hard to fund them. And we talk about them as perpetual entities, but there's not perpetual funding. So if you come with funding, you can fund the trial. If you're coming with funding, you should probably be setting aside some money to fund the platform infrastructure because these things probably aren't as efficient as we all think they are, and there's central costs that you should be contributing to. You can fund other investigators' time to help the machine keep running. And the important thing is you can fund your own time. And if you get a fellowship, this model is really important because on a grant in the UK, you might be able to fund 4 or 8 hours a week of your own time. If you get a fellowship, you can fund 32 hours a week. And if you turn up to the chief investigator of the platform and say, I've got 32 hours a week to deliver this domain, suddenly that's like manna from heaven because you're going to take away all their problems. And you've demonstrated that you've added value to the platform because you can deliver. And also the last point is you can get access to funding streams that a chief investor can't. So examples of this are, a HDA postdoctoral award in the UK, UKRI Future Leaders Fellow, there's British Heart Foundation. I accept this is very UK centric, but I think the HRB have similar. If you bring time and money with a work ethic, I think it probably goes a very long way. And it is possible to break into other platforms as an early career researcher that doesn't involve your mentor being part of that platform from the get-go, or it being Panther, which is playing chess and everybody else is playing checkers. Okay, thanks.